I'm an occupational therapist, and I trained to be an occupational therapist back in Ireland several years ago now, or quite a few years ago. I'm also blind, and when I first applied to university, I had a range of questions of asking me, could I be an occupational therapist while being blind? And over the course of my education, and certainly when I was working in practice, I found that actually being blind could be an advantage. So when I was working with people in stroke rehab, for example, I couldn't see to fill in the forms, but some of my clients could fill in their own assessment sheets. Therefore, they had control over what they wanted to put in that information. So that changed the power dynamic. They recognised that as a blind person, there were certain things that I couldn't do, but there were many things that I could do.
I remember once I was looking after a female patient who'd had a stroke, and she had lost ability of one side, and she was really upset one morning when I was helping her to get washed because she was unable to put toothpaste on her toothbrush. So I showed her actually how you can do that really effectively with one hand. So if you can imagine this is the toothbrush, I told the patient if she put the toothbrush in her mouth and squeezed the toothpaste on, then she would be able to, and it was little tricks like that I was able to help patients with, and they could see that actually, although they were going to have to adapt, it wasn't unachievable.
I think diversity is an important agenda for health and social services as well as society at large, really. So many people that use services come from very, very different backgrounds, really. So ideally, what we want to be doing in the school is help to create professionals who marry those backgrounds. So the more we can get a diversity of age, ethnicity, religious, sexuality backgrounds, the better, really.
And when you're working with somebody, you need to understand that their values may well be very different to yours. So the more experience you've had of working with different values and beliefs really helps you to work as an occupational therapist, really identifying and being able to understand that everybody's different and everybody's unique.
We will always have patients from different backgrounds and different faiths, and to have nurses from different backgrounds will mean that the patients will be more relaxed because they know that there is someone that will understand them.
There is nothing, no favours to anybody else. Everybody is equal.
And that's part of the things that's made Britain so great, I think, of the fact that we are a diverse nation.
There are lots of career opportunities for anyone, whether disabled or not. It covers such a vast area, from acute physical through to mental health, learning disabilities and brain injury. So there's so many areas you can go into. Also now prisons have occupational therapists as well. So it's such a diverse area to work in. I feel very blessed that I'm in that profession now.
As a school, we're very committed to the NHS Constitution, which is a government policy that articulates the expectations around values and beliefs being respected in the National Health Service, so that practitioners are able to support people from diverse backgrounds and all sorts of different communities.
Having a diverse group of students is actually really useful and important on a physio programme, because ultimately students learn a lot from each other, from discussing things, but also in practical scenarios. So actually having a diverse student population helps generate ideas, discussions, that if everyone was coming in with very similar experiences, actually produces less of a stimulating environment. So certainly our physio students and groups of students we take on every year, there's often a real mix of people, from school leavers to quite mature students with different work backgrounds, so it provides a really nice learning environment.
And I think one of the most things that you do learn is people's personal experiences, and you can sort of, if you've got a good mixture of people on the course, and you can really get that.
It really balances the groups out because you've got the people coming from different backgrounds, different ages, and with lots of different experience. A lot of our students have maybe done other jobs in the past and then have decided, yes, I'd like to be a midwife and have a career change completely.
Is recognising that there are other people with different views, with different perspectives. There are service users who have a right to be listened to and to be acknowledged.
It's about the attitude towards the community and the environment that we're working in, and it's just about being open-minded. It's about being accountable for your actions, being responsible to the people you work with and the people that you live around.
There's a whole variety of support mechanisms for students. There's academic support, obviously, from their tutors and the academics who work with them. But we have people who help students who have additional learning needs. We have chaplaincy, we have counselling services, we have Ask BU, as well as the Grow at BU initiative, which is a student engagement team of fairly new graduates who provide social support to students as part of the whole package.
We have a large number of students that may have something called a specific learning difficulty, which may be dyslexia, dyspraxia or dyscalculia. And I would say many students actually in those types of disabilities tend to do very well on professional-based programs that's largely practice-based. So in practice, actually those students tend to excel. Where they may need a little bit more support is actually in the academic side. And so what we have here is we have the Additional Learning Needs Service, which can support the students in developing their time management skills, their academic writing skills, but we also have those types of support built within the programme within their academic advisor. So there is no reason why anybody or a student with a disability shouldn't be able to succeed in a programme in health and social care.
The trick for somebody from a different background is to get over that education, and that's why in BU we're really committed to promoting diversity so that people feel equal in the classroom, so that your experience of being the first from your family to go to university, your experience from a different cultural minority, your experience as somebody with a disability or additional learning need, actually that's important, that's valued, and that can enhance your practice.